Welcome to HITshow, your go-to source for today's leading healthcare business headlines. I'm your host, RHONDA Brooks. It's Tuesday, February 10th, and this is HITshow. Today we're looking at the forces shaping healthcare right now, workforce pressure that isn't letting up, new federal policy moves that could affect costs and competition, and technology that's finally moving beyond pilots and delivering real operational results. We'll also take a quick look at what executives are watching as the ViVE conference approaches in just 2 weeks. Let's get started. Labor pressure continues to be one of the biggest operational challenges facing health systems, and the latest developments are coming from both coasts. Teresa Vaughn is following this story. Teresa?
RHONDA, we're seeing important developments in two major healthcare labor disputes. In California, the Kaiser Permanente strike continues to affect operations across multiple facilities, with tens of thousands of workers involved in disputes centered on staffing levels, wages, and working conditions. The scale of the strike is forcing administrators to rely heavily on contingency staffing and operational adjustments. Meanwhile, in New York, negotiations have produced tentative agreements at several major hospitals, including Mount Sinai and Montefiore, which could bring thousands of nurses back to work. However, not all facilities have reached agreements, and staffing concerns remain a central issue even where deals are close. The common theme in both situations is that workforce shortages and retention pressures are not temporary disruptions. They're becoming structural realities that health systems are being forced to plan around.
Teresa, what are administrators most concerned about right now? The immediate staffing gaps or the longer-term cost implications?
It's really both, but the longer-term concern is sustainability. Even when strikes are resolved, the underlying drivers, burnout, competition for staff, and rising labor costs, don't disappear. That's what executives are planning for now.
Teresa Vaughn, thank you for the update. Federal policy is also moving in ways that could shape costs and competition across the industry. Peter Betterworth is following this one. Peter?
RHONDA, federal regulators have proposed new rules aimed at increasing transparency and competition while continuing efforts to control program costs. While these proposals are still in the rulemaking phase, they signal continued pressure on hospitals and health systems to demonstrate value and efficiency, particularly in areas tied to reimbursement and reporting. For executives, the key takeaway is that regulatory expectations are not easing. Compliance requirements, data reporting, and cost controls remain central priorities in Washington, and those priorities are likely to shape operational strategy throughout the year.
Pete, what should leaders be watching most closely as this develops?
Timing and implementation details. Proposed rules often evolve significantly before they're finalized, but organizations that start preparing early tend to avoid the biggest disruptions later.
Peter Betterworth, thank you. With the ViVE Digital Health Conference now just 2 weeks away, attention is turning to what healthcare leaders are actually hoping to solve, not just what vendors will be showing. Logan Stokes has more. Logan?
RHONDA, one of the biggest shifts heading into this year's ViVE event is a change in tone. Hospital and health system leaders are increasingly focused on return on investment, operational efficiency, and technologies that integrate into existing workflows rather than adding complexity. In conversations across the industry, the priority list is clear: tools that reduce workforce strain, protect revenue, and improve patient flow. The era of pilot projects without measurable outcomes is fading, and executives are asking tougher questions about results.
Logan, we'll be watching that closely over the next couple of weeks. Thank you. After the break, we'll look at where technology is actually delivering results, from population health and value-based care to virtual nursing and the rapid growth of remote patient monitoring. Stay with us.
Healthcare leaders don't have time to waste. That's why they trust HITshow Daily for the news that matters. It's fast, focused, and relevant. If your company solves real problems for hospitals and health systems, you belong here with us. Learn more at HIT.show.
Welcome back. You're listening to HITshow. For years, healthcare technology has promised transformation. Now we're beginning to see where some of those tools are delivering measurable operational impact. Nate Collier has this story. Nate?
RHONDA 2 developments this week highlight how healthcare technology is beginning to show measurable financial and clinical results. First, Integrity Health reported improved patient outcomes and a significant reduction in inpatient costs after deploying a population health platform to coordinate care and identify high-risk patients earlier. According to recently released data, patients managed through the program saw inpatient costs averaging about 16% lower per claim, along with shorter hospital stays and lower readmission rates compared with patients treated outside the coordinated care network. That's the kind of measurable ROI hospital administrators are increasingly demanding before scaling new technologies. A second example comes from value-based care networks, where organizations like Aledade continue expanding participation among independent practices. Growth in these networks reflects a broader shift toward coordinated care models designed to improve outcomes while controlling total cost of care. Taken together, these developments point to a larger trend. Across the industry, we're seeing increased adoption of technologies that directly address operational problems. Virtual nursing programs are helping extend workforce capacity by allowing experienced nurses to support bedside teams remotely. And remote patient monitoring continues to gain traction, particularly in chronic disease management, as reimbursement pathways improve and health systems report fewer readmissions and better patient engagement. The common thread is that technology adoption is increasingly tied to results. Health systems are moving beyond pilot projects and focusing on tools that demonstrably reduce cost, improve outcomes, or relieve workforce pressure.
Nate, is that shift toward measurable results what's driving the conversation we're hearing ahead of conferences like ViVE?
Exactly. Executives are asking tougher questions now. Instead of asking what a technology can do, they're asking what it has already proven it can deliver, and whether those results can scale.
Nate Collier, thank you. Looking across today's stories, a few themes are becoming clear. Workforce strain is no longer a temporary disruption, it's part of the operating environment health systems must plan for. Financial discipline continues to shape decisions at every level, from staffing to technology investment. And innovation is entering a new phase where tools are expected to deliver measurable results, not just promise future potential. At the same time, regulation and reimbursement policy continue to evolve, ensuring that operational strategy and compliance remain tightly linked. Those are the forces shaping healthcare as we move deeper into 2026. That's all the time we have for today. Thank you for joining us on HITshow. If you liked these stories, please follow us on LinkedIn and check out our in-depth feature videos on HIT.show. HITshow, your go-to source for healthcare business news, can be found all the places where podcasts are heard. Please join us again tomorrow for the latest headlines in healthcare.